So corneal transplants have been around, I think since 1905 was the first successful one. And that was kind of front to back transplant, replacing the whole thing. And that technique was kind of the technique for up until maybe 10 to 12 years ago, when a guy named Mellis, M-E-L-L-E-S, in Europe, in Amsterdam, actually described a technique for just replacing the inside lining of the cornea for diseases where that was the sick part. The cornea is very, very thin. It's about 540 microns, so super thin, but it has different levels to it and different structures within it. So the thought was that when one structure is sick, why replace the whole thing? Because the whole thing is, it's a great surgery, but the outcomes can be not that wonderful. Because you're cutting off the entire front part of the eye and replacing it with donor tissue, so you can get rejections and all kinds of other issues with, trauma can cause the eye to open back up and the inside of the eye to come out, which we don't want. So we can do a small incision where we just replace the inside lining of the cornea and restore vision that way. It works very well. If there are diseases that are full thickness or diseases that affect the front part of the cornea, we can just replace some of the front of the cornea or the whole thing. So for a full thickness transplant, we take you to the operating room. We put an IV in your arm and make you sleepy. Sometimes we do it with you awake. Sometimes we do it with you completely asleep. Kind of depends upon the patient and what we're actually doing. And then, that's kind of the patient experience. They're relatively sleepy during the surgery, but for my experience, what we do is then measure the cornea and kind of mark it, and then prepare the donor tissue, which comes from obviously someone who died. I get emails from the Iowa Lions Eye Bank looking at what is the patient's age, et cetera, the donor info, and make sure that that meets our criteria. That cornea comes, just the front part of the eye, the white part, and then the cornea. And what we do is we put it underneath a little press. It looks like a little cookie cutter, and punch out the part that we want to use. So let's say 8 millimeters. And then we do the same thing to the patient's eye, and we cut the patient's cornea off with a little kind of cookie cutter that we partially go down into, and then use scissors to cut the rest of it off. And then real quickly put the new cornea on and stitch it in place with a lot of really, really tiny sutures, usually about 16 or 24. And then the patient wakes up and they come out of surgery with a patch and shield over their eye. They leave that on for a day or so. We take that off, and what I tell my patients is your vision is not going to be perfect the next day. It's not like cataract surgery where you go in, your vision's bad, you come out, and wow, you see wonderfully. Unfortunately, it takes a long time to heal up from this. So I tell people it's really about a year of visual rehabilitation. The stitches have to stay in for about a year before we can start taking them out, because the wound does not heal very well. Unlike your skin, which has a lot of blood vessels, the cornea doesn't have any blood vessels, ideally. So that wound takes about a year to really become solid enough where we can take stitches out and kind of modify the wound healing. I also tell people that if you think about when you change a tire, you put the bolts on in a specific pattern to try and make the tire even so it's not wobbling. We do the same thing with the cornea when we stitch it on, but your body heals irregularly, meaning that in one area will heal tighter than another area, and that will induce what's called astigmatism, where the cornea is no longer round. And when it's not round, it doesn't bend the light appropriately, so it makes it hard for the person to see. So as that year progresses, we take stitches out to try and normalize the surface of the eye so that they can see. So during surgery, the things that I tell my patients that I'm most worried about are bleeding and infection inside the eye, and those are very rare, sometimes 1 in 2,000 to 1 in 5,000, depends on what studies you look at. But those are the scary things. If you get a hemorrhage within the eye as you're operating, that's very bad. The eye is kind of like a water balloon, and we're obviously going to make a big hole in it, and a water balloon wants to decompress, and if the eye decompresses, everything inside the eye comes out. That's very bad. Then game is over. You lose all vision. Okay, so that's the scariest thing that can happen to us. Luckily, that's very rare, and we just try and work as quickly as we can. We take the cornea off, put the new cornea on, sew as fast as we can, and as cleanly as we can to get it done and get the eye repressurized. Infections happen, usually not during surgery, usually after surgery. Rejections happen maybe about 10% of the time, again, depending on what we did this surgery for. Those are the main ones. People who have had a full thickness transplant, they've got a risk of dislocating the transplant, because I said that wound is not very well opposed. It doesn't heal super well. So if you got punched in the eye or something like that, it could definitely come apart, and then again, the inside of the eye can come out. So that's also a very scary thing that could happen. It's outpatient surgery, so people go home that same day. And for a full thickness transplant, they've got a patch and shield on, and they just kind of take it easy and don't really do much. If we do one of the partial thickness transplants, we actually put an air bubble inside the eye, and that floats the new tissue up against the old, because you're looking up towards the ceiling. And that tissue has to sit there for that air bubble and that tissue has to sit kind of in apposition for 24 to 72 hours for it to kind of stick and do its thing. So those people have to be on their back for maybe 1 to 3 days. It depends on what we're doing. And then visual recovery is a process over the next year if you're doing a full thickness transplant, and maybe like a month to 3 months if you're doing a partial thickness transplant. But in terms of recovery, I mean, they're kind of back to their normal self within a week, other than they have to take it easy. We don't want them lifting heavy things like with any eye surgery, because that puts pressure on your eyeball, can cause the wound to break open. We don't want them getting in bar fights. Trauma to the eye is a bad thing. But for the most part, there's not a huge recovery period.